Hey everyone, so today we're doing another surgery squad, but this time it's rhinoplasty, aka nose job, so let's start. That looks disgusting.
Welcome to Surgery Squad's virtual closed rhinoplasty surgery. I'm Dr. Susie. Today we will be performing rhinoplasty. It's what's commonly referred to as a nose job. In this cosmetic surgery, our patient is a young lady who's looking to change the shape of her nose. We'll perform a closed rhinoplasty procedure to reshape her nose into something she finds more appealing. Some surgeons will perform this surgery using a local anesthetic and sedation, which makes the patient numb and in a dreamlike state. I prefer to work with a patient under general anesthesia and completely asleep. What we're doing today is reshaping the bridge of the nose. Our patient feels it's too wide and doesn't like the hump on it. The thinning of the nose is called an infracture. I'll bet you can't guess what the widening of the nose is called.
Outfracture.
Alright, I'll tell you. It's an outfracture.
Yeah.
Some patients may also want the tip of the nose reshaped. That's called typoplasty. But as I was saying, this patient only wants an infracture and some reshaping. Easily done. To begin this procedure, we need to open the nostrils as wide as possible. We do this with a retractor. Can you place the retractor in the patient's right nostril? Now with the nostril open wide, we'll make an incision inside in a crescent moon shape. That will allow us to access the bones and cartilage that make up the nose structure. I've made the incision. Can you use the forceps to remove that portion of the nostril? Surgeons must be hyper-vigilant when doing this portion of the procedure, as it can damage breathing and sense of smell. To reshape the nose, we're going to chip off the dorsal hump with a chisel tool called the osteotome. We place the osteotome at the base of the hump and then carefully tap on it with a small rubber mallet. This has to be done very gently and takes a careful touch. I'll position the osteotome and you tap the end with the hammer.
Yay, I get to tap it.
Now that the hump is loosened, we need to pull the bone and cartilage out of the nose. Use the tweezer-like forceps to slip it out of the incision. Now that the bump is out of there, we need to smooth the edges on both sides with a rasp. The space left by the bone we've removed is referred to as an open roof. To close the open roof, carefully tap the osteotome along the path that I've marked. This breaks the nasal bones so we can reposition them. Tap the osteotome once each time I reposition it on the left and right nostrils.
Okay.
Now that the bones are broken, I just take my fingers and reposition them to close the open roof. Because we made such perfect breaks, the bones slip right into place and the nose is perfect. A few stitches to close up the incisions,
I'm not doing
and
anything.
then we place nasal airway splints in each nostril to hold things in place. Steri-strips go across the nose, and an external nasal splint is added to hold everything tight. Our patient will have some bruising and minor pain for a few days. We'll remove the splints in about a week. Most of the swelling will be gone by then, but there can be a bit left for a few months. And there we have it. Thanks for coming by. Catch more of my great surgeries here at surgerysquad.com.
So basically I'm gonna go ahead and do another one. So see you then. So I'm back with Surgery Squad's liposuction.
Welcome to Surgery Squad's virtual abdominal liposuction. I'm Dr. Susie, and I'll be assisting you with this surgery today. Liposuction is a minimally invasive surgical procedure that is used to remove fat deposits from various areas of the body. The areas that liposuction is generally performed are the abdomen, hips, inner and outer thighs, flanks or love handles, and inner arms. Today we'll be using the tumescent technique to remove fat deposits from our patient's abdomen. The word tumescent means swollen and firm, and with this technique we'll be injecting such a large volume of the fluid into the fat deposits that our patient's abdomen literally becomes tumescent. After injecting the fluid, we'll be using a hollow metal tube called a cannula to break up and essentially vacuum fat deposits out of the body. Before we begin, remember that liposuction is not an alternative to diet and exercise, and, unfortunately, not everyone is a good candidate for liposuction. To be a good candidate, one must usually be over 18 years old, in good general health, be within 30% of their ideal weight, and have made an honest attempt at losing weight through dieting and exercise with little success. Luckily, our patient is not only a great candidate for liposuction, but she doesn't smoke, which will greatly speed up the recovery process. Now that we've covered the basics, let's scrub in. The first thing we need to do is mark the target area. This provides our patient and ourselves with a clear idea of where we'll be removing fat deposits. Why don't you give it a shot?
Okay. Let's go. Okay, this is kind of weird now because I can't do it very nicely, but the game will just automatically fix it already anyway. So I don't really bother with this too much. I'm just gonna do it really badly.
That looks great.
See?
Now we need to take photos of our patient so she can see the before and after results. Go ahead and take one picture of the front of the patient's abdomen and one picture of the side. Next, we'll have our patient turn to the side so you can take the second picture. Nice composition. Our patient has been prepped and is now in the operating room. The next step is to numb the incision points that we're going to use to extract the fat deposits. Give it a try. With the incision points numbed, we're going to inject the tumescent fluid using an infiltration cannula to anesthetize the target areas and dislodge the fat deposits, making it easier to suck them out.
Can I just
go ahead and take a stab at it?
Thank you. Right. Let's see. This is so annoying. Why won't it do it? I switch to this one. There we go. Easy up. Ah! Right, I just... There. Finally. Alright.
Excellent job. Now that we've injected the tumescent fluid, let's begin the liposuction. Use the suction cannula to remove the fat deposits from the patient.
I'm just clicking everywhere.
You're a natural. Have you ever considered a career in the medical field?
Yes, I have.
Now that we've completed the liposuction on our patient, it's time for recovery. We're not going to suture the incisions. Since they were so small, they can heal without sutures. Our patient will need to wear a compression garment for 2 to 6 weeks. This garment holds the tissues together, controls swelling, and provides additional support as her body heals. She should be able to return to normal activity within a few weeks, and there will still be some bruising that should fade within a few days.
Oh my
Any
gosh,
swelling that our patient has may take a little while longer to
difference.
subside. The final result of the liposuction will be evident in about 1 to 3 months after the surgery, although they will see a noticeable difference within days or weeks. Although the suctioned fat deposits are gone, if the patient does not maintain a proper diet and exercise regimen, the remaining fat deposits could enlarge, creating irregularities in the patient's abdomen. And that's abdominal liposuction. You've done a fantastic job. Why not try your surgical skills in another great surgery here at surgerysquad.com.
Alright, so that is the end of the video, guys. I know, sad. Anyways, bye.